Let's talk about delegation questions. If you struggle with delegation questions on your nursing exams, it's probably not because you don't know who does what. It's more probably because you're falling for the wording that's listed in your either the stem of your question or the answer choices that you're given. Now, it's not necessarily trying to trick you. It is wanting to know that you can differentiate between one task versus another and legally who is responsible for that. Here's what you need to remember. The RN is not just in charge of the hard stuff. They do the things that require clinical judgment. So that includes assessing, teaching, evaluating, planning, care planning, and caring for unstable or unpredictable patients. As the RN, you do not delegate those responsibilities, not to the LPN or the CNA or the UAP, none of those things. You do not delegate, you keep that task for yourself. Here are some things that you can delegate as the RN to the LPN. LPNs can reinforce teaching rather than doing the initial teaching. They can collect the data, but they cannot interpret the data. Of course, they can do routine procedures, but really only for those patients that are stable who have expected outcomes. And our UAPs or our CNAs, they can support with basic care, things like hygiene, ambulation, feeding, vitals, definitely not assessments, and not any kind of decision-making tasks. Listen, if there is even a hint of instability with your patient, bleeding, airway involvement, or any kind of newness, like a new trait that they've just gotten, that stays with the RN. Remember, delegation questions on your NCLEX are not just about who's available to help you out. It's about the level of clinical judgment required for that specific task legally. Now listen, this does not mean that other roles are not skilled. It just means that based on the legal scope of practice, the RN is held accountable for these actions. And most importantly, try really hard not to overthink it.